Greetings, everyone. I am so glad you joined us today to talk about something very important for those in the home care industry. A major shift is happening right now in dementia care, and it's my understanding that home care agencies are uniquely positioned to lead it. So I'm very happy to have Debbie Miller back with me today. We always love having Debbie come to chat with us because she's just a wealth of information. She's a home care agency owner herself and the founder and CEO of 52 Weeks Marketing and the founder of Helper Heroes, which I'm super excited to learn more about later, Debbie.
Okay.
Don't let me forget. She's wears so many hats. During this session, though, Debbie's going to break down how the GUIDE model opens up new doors for agencies that are ready to move beyond traditional private pay and into a more strategic, collaborative future. So, Debbie, welcome. Will you please help us understand what GUIDE is and why it exists? Because I get this question
Yes,
a
I'm
lot.
sure you do. And I've heard from other agencies across the country that they know there's an opportunity here. They just don't know how to grab hold of it. And so that's what today is all about. So I am really excited to share the biggest opportunity to hit home care, certainly in the 18 years that I've owned an agency. So I do have an agency in the greater Nashville area, pretty large agency. I've been doing this since 2008, so it's been a while. But when I first heard about the GUIDE program, I knew there was something to this that was going to be hugely beneficial for our business. And so I jumped on the bandwagon really early and had some pretty major challenges along the way that we've been able to really iron out within my own business. So I'm going to help you guys understand what I've learned, and we've created a model to make it really simple for you. So I'm really excited to take you through and help you all understand that. So let's start first of all with what is GUIDE. So this is the first ever Medicare supported program, and it's mainly designed to support the family caregiver. So for the first time ever, and I think what's happened is Medicare or CMS has really come to the understanding as to how important these family caregivers are. They provide billions of care hours to their loved ones. And if, something happens to them or, they stop doing that really important responsibility, we just do not have the infrastructure to support the number of people that have dementia. So this whole program is designed to support the family caregiver. And I'll take you through the components of it just a minute. But GUIDE stands for Guiding an Improved Dementia Experience. And that's the focus, is to make this a more positive experience for those family caregivers. The amazing thing for home care agencies is that one of the components is an annual respite budget that they provide. It's $2,500 in respite care for us, for home care providers. But you've got to be linked in, you've got to have a partner, and we'll go through all of that. But this is a really big opportunity. I'm going to break it down for us in just a second here. So back to why this is going on, why this exists. And we are seeing the aging population every single day. 10,000 people are turning 65. At the front end of that is the fastest growing age group, which is amongst 80 to 85-year-olds. So people are living longer, but they're living with chronic conditions, and dementia is one of them. So we're seeing the number of folks that have dementia really rising. And what does that do? That puts more burden on the family caregiver, right? So they're overwhelmed. The support system in general is very fragmented. And so that's where CMS is really hoping to fill the gap and provide a model. This is really a model that they are initiating, and it's actually for 8 years. So they're going to be testing this out for 8 years, which is very unique in that time frame. I don't know of any other programs that went as long as 8 years. So they expect that they're going to learn a lot. My expectation is they're probably going to see the impact that this is having, then extend it and maybe even up that budget. Because at the end of the day, $2,500 doesn't go that far, but at least it's something, right? So we'll get more into the specifics. But again, it's the family caregiver that's really at the center of this. And when you think about what they deal with on a daily basis, the average family caregiver will provide 22 hours of care to a loved one and still working a full-time job And 66% of them are spending their own money to provide the support that their loved ones need. So as a result of that extra stress and now the financial stress, it puts a lot of strain on them. So this program is really designed to support them and rally around them. So here are the components of the program. There is a comprehensive assessment and care plan that is provided. There's caregiver training and education, care navigation and coordination. So a family is actually assigned a care navigator. It's sort of like a care management model, but specific to dementia, right? So think about care management, Medicare supporting care management. It's a very similar model as that. A guide approved provider has to provide 24/7 access to support line. So for families that are just at their wits' end, maybe at 3 in the morning, they don't know what to do, they can call and actually get a live clinician that will answer the phone. So it's pretty amazing. And then, as I mentioned, up to $2,500 a year in respite care if they qualify. So all of these components are provided for free for those folks that qualify. And there's a little bit of an enrollment process, which we'll talk through in just a second. But that there's not even a co-payment. You don't have to qualify financially. So there's nothing really like it. And so that's why it's just such an amazing opportunity for us to partner with these credentialed guide providers and to be able to come alongside these families and provide the respite care for free. So we do that.
Amazing.
I know, it's amazing. So this is where the home care really comes in, but we do have to have a credentialed partner involved in this. And I'm going to help you get connected here at the end. We'll talk you through the program that we've created. So let's talk about the criteria. What does a patient have to do to qualify for this program? Well, it's pretty simple. And again, as I said earlier, this is not a financial situation where they have to, have a certain earnings or be below a certain earnings. They do have to be a traditional Medicare beneficiary. All right. They have to have a diagnosis of dementia or suspected diagnosis. And so when you partner with the clinical team, they can actually help that family get that diagnosis. Because a lot of times, and as a matter of fact, I think it's only 5% of people with a dementia or an Alzheimer's diagnosis actually have a diagnosis. But there are a lot more people and a lot of families who know their loved one has dementia. So we think that the numbers we're targeting sort of the folks that do have the diagnosis, but behind that are these huge numbers of people that will be able to, as they learn about the program, come in and actually get diagnosed. They do need to be living in the community. So what does that mean? They could be living in a house. They can be living in an apartment in an independent living facility or a retirement community, even in an assisted living or memory care center. So they still qualify even if they're in memory care. And then they do need to have a family caregiver because there's a process to this. And they are, again, this is designed to really support that family caregiver. So pretty simple as far as the qualifications, mainly that traditional Medicare insurance. It cannot be an Advantage plan. So here are the patients who will not qualify. Anybody that is in an already established Medicare program or special needs program, if they are a Medicare Advantage enrollee, if they live in long-term care, and what I mean by that is skilled nursing or long-term care nursing home. All right. They can't be enrolled in hospice and they can't be already participating in a PACE program, which is another Medicare program. So it's no double dipping here, which is what they're trying to avoid. So those are the folks that wouldn't qualify for the program. Now, what we need to understand is that, why home care agencies are really essential to GUIDE. So I guess it was maybe 2 years ago when they put, maybe longer, where CMS allowed folks to enroll and become credentialed as a Medicare provider. And those folks are already credentialed with Medicare. All right. So it was a 400-page submission. I mean, there was a lot to that. And so those certified providers don't typically have the hands-on local support. Most of these care management companies are running or managing the program virtually. So it's like a virtual clinic or clinical office. All right. So they don't have the ability to provide that one-on-one respite care. So that's where the home care agencies come in and partner with them. And the reality is they really need us to satisfy that key component of the GUIDE program. So this is, for years and years on so many presentations that I've done over the years where I've said, guys, home care is the place to be right now. These models are changing and people are looking for home care partners to deliver the services that they're going to be, be in place, this hospital, home, SNF, dementia care at home. Here we are. So here we are where, if we're not out there and we're not taking advantage of this, we're going to miss out on this opportunity. So the day has arrived and they actually need us. And here we are.
So to recap, it sounds like the GUIDE program is not going to be complete without the respite portion. And the GUIDE providers really need a partnership with a home care agency to provide that respite care. And locally is the key also, right?
Exactly.
But what you just said is like so important. It is a huge opportunity for home care. And I know, yes, you've been preaching on that for years. So
Yes.
Take advantage of this. But I'm anxious to hear what your personal experience has been with the GUIDE program in your home care business. So can you break down how this would work for other agencies and what it could mean to their bottom line based on your
100%.
experience?
This is my favorite part. It's helping quantify what this could mean to your revenue, to your growth, access to new clients that you would not have had access to without this opening. And what we've found is GUIDE has opened the door to a lot of referrals that we would never have had. So I'll delve into that a little bit more, but let's just look at the landscape. So there are somewhere between 6 and 7 million already diagnosed CMS patients that already have a dementia diagnosis. All right. Now, supporting them are millions of family caregivers. Okay. So they are typically the ones that make the decision about going ahead and enrolling with the GUIDE within the GUIDE program. By the way, I did want to go back and say, not every person that is qualified or enrolled in GUIDE receives the respite care component. So they have to be more moderate to high in terms of their dementia. So I just wanted to make a note of that. But eventually, they typically over time will qualify for the respite care. So there are just millions and millions of people that are already qualified for the GUIDE program and for the respite care component, which is what we are able to deliver. So this is obviously a growing concern. And what I want you to understand when we think about timing and why this is so important that we jump on this now is because CMS is in the process of sending out all of their patients. Anybody that has a diagnosis will receive a letter educating them about GUIDE. So we've already seen the first wave go out, and doctors are getting these patients coming in and asking them questions when they don't have a clue. So we've got all of our healthcare providers and referrers that we deal with that we want to get out in front of this. And so that's something that my team has been doing. And when the letters started going out in December, and we were the first in our community to be educating them about this. And then sure enough, when the patient walks in with a letter, they know exactly who to refer to. So what we've done in my community is we funnel all the referrals to us, and then we enroll them with our partner so that we're in more control of the situation. And we've created a model that's expedited and is streamlined now, because as I said earlier, I learned the hard way. I started with 1 or 2 providers. They didn't really have the infrastructure that was necessary to make this smooth. And we would make referrals to them, and it was like these referrals went into a black box. And it would be months and months before we heard anything. So we were out in the market generating all this excitement about the program, and it was like, hurry up and wait. So what I partnered with an amazing company who had a much better infrastructure and helped them actually create the technology that has streamlined the whole process. So back to the opportunity. So we've got somewhere between 6 and 7 million patients who qualify. We've got these about 12 million caregivers that we talk to them every single day, right? Our referrers talk to them every single day. So they can definitely be instrumental in pushing the person that they're caring for into the program, and we can hold their hands through this whole process. So there's this short-term amazing impact of those folks that have already been diagnosed, but right behind that are all these people that have not got a diagnosis that we're going to be able to steer to our partner, get that diagnosis, not to mention the folks with mild cognitive impairment who typically develop into dementia, right? So we have this short-term amazing opportunity, and then behind that is this long-term opportunity for our services. So we're looking at about $100 billion opportunity here in these long-term care services. And right now, wherever you are watching this webinar, there are thousands of people in your community who are ready for GUIDE, and they just need somebody to steer them in the right direction. So this is incredible. And I'm telling you, we're probably, I can't even tell you the number of referrals we're doing on a weekly basis now. And I'm going to show you the revenue impact.
Well, I feel like, sorry to interrupt, but I feel like this too is going to be something that pushes doctors into diagnosing more efficiently, because they're like, hey, there's help and support. And maybe families will hear about this more. It'll be in the news more, and they might push their families, since they know they're going to be the family caregiver, they might start pushing their family members to go to the doctor and get that diagnosis.
Exactly.
Too.
Yes, there are several pathways. I'm going to show you 2 pathways for the home care provider. Okay, so I'm going to try to help people understand how to frame the opportunity. So there is, first of all, the patient direct path. All right, so where like you're saying, where the doctor has heard about this, maybe they've gotten the letter, and the CMS letter has some GUIDE credentialed providers listed on there. So they'll call the providers directly, and they will then enroll them in the program. And then when it comes time for the respite piece to be satisfied, they're going to send referrals to their partners. All right, so to us who are there, who have made that, that agreement with them, and have agreed to provide the respite component of this. So we're going to have this direct path of referrals that will come from our partner, and I'm going to give you an opportunity to connect with us and have this made kind of a little bit easier for you. The second path is what we're doing in the community to educate folks, whether it's family members, whether it's our referral sources who we're already calling on. We're going to educate them and mobilize them to identify those family caregivers or those patients who need the GUIDE program, and we're going to direct them to us. So they're going to be sending their referrals to us, and then we'll be able to go to our provider, enroll that person, and we are more in control of the relationship. All right, we're driving more of those referrals. So we've got the opportunity to generate those referrals and guide them into this process. And then also think about all of your current clients within your customer base now who would be eligible for the program. So you'd be able to enroll them in the program. These are the low-hanging fruits. These are major opportunities for you. So you may already be providing a certain number of hours, and you're going to be add an additional $2,500 worth of hours.
Yeah,
that's it. That's amazing. So I'm going to here really spell this out here. What are the opportunities financially? Okay, so you've got your revenue growth from coming from these pathways. Okay, those two pathways that I just told you about. It's $2,500 a year in respite care. Okay, so just if you just look at the guide dollars, that's $2,500 that you wouldn't have had. But here's what's neat: it renews every July. So the opportunity right now, if you were to get out early in 2026, and you get these folks enrolled, there's $2,500 and it renews in July. So you could literally have $5,000 in revenue opportunity in 2026 for that patient. So those are the guide dollars that are available. Then you've got this opportunity. Once you've got your foot in the door, they are going to get a taste of what home care is like. They may want to continue with your services and pay you privately. You may be able to open the opportunity and they didn't know that they are eligible for VA benefits, for long-term care insurance benefits. They might have a long-term care policy that nobody talked to them about. They might be eligible for Medicaid if you're a Medicaid provider. So you get exposure to this amazing group of clients that you would normally never had access to. And you'll have an opportunity to grow those folks. And so what we're seeing is a 30% conversion in my business. 30% of them are converting to either private pay or other payer sources that we now have an opportunity to open their eyes to.
That's huge, Debbie. That's a huge number.
Oh, wait till you see it. See how it shakes out here in just a second. So, and then finally, you've got your existing clients. It's like free money. And boy, do you look like a star when you can call them up and say, hey, I want to see if you're eligible for this program that could get you an extra $2,500 in care. But here's the key: add it on to what you're already doing. Right. Don't replace it. So you get to add on and grow your revenue. All right. So let's take a look at the math. All right. And this is kind of based on this is actually lower than what we're seeing, but I wanted to kind of be as conservative as I could. Okay. So if you look at if you started this in March and you go to June, which is the end of the 2026 cycle, and then it starts again in July. So if you were just generating 10 referrals a month. So 10 referrals. And by the way, guys, when you get out there talking about this, it's like, I talk about the referral faucets, turning on the referral faucets. They just come out of the woodwork. All right. And the more you're out there educating, the more your referrals you're going to see. So 10 is easy. So 10 referrals a month. That's going to take you through to July, and then it starts all over again, but then you're continuing to grow another 10 for the rest of the year. That would generate, just in guide dollars, $400,000. Now, if you converted 30% to just 12 hours a week, that's an additional $655,000. So I'm calling this the $1 million opportunity here.
No kidding.
Isn't that amazing?
At the conservative level, based on what you just said.
Yes.
Wow.
That doesn't even include the direct referrals that you're going to be getting from your partner. So yeah, awesome. It's pretty exciting. So we definitely do have to have a credentialed Medicare partner to make all of this work. To generate that $1 million, you've got to have it. And so what we've done, and part of it is, by the way, you don't want to even worry about all the stuff that they have to worry about. Like, it is the compliance on that program. I mean, it's something else. So what we do is we just get to do what we do best, which is provide the care and the respite care. But it does take having a partner, and then us as the home care agency. It's a collaborative approach here. And I'm going to talk to you about the program that we've put together to help people get partnered up quickly. And we've wrapped a whole marketing program around this, because I've seen too many agencies not do a darn thing with GUIDE because they just don't know how to get started. So here's a sample of the letter, all right, that's gone out. So this is continuing to go out and in phases throughout this year. And our partner has actually seen a 400% increase in the number of direct patient referrals that have come in that way. So what you've got right now is this sense of urgency because the cat's out of the bag because the CMS letter has gone out. So patients are asking their healthcare professionals about this, like how do I get started? And they don't have a clue. So there's this amazing opportunity right now to educate your healthcare providers and partners in the community and position yourself as the guide expert. Okay, guide ready. We're going to talk about that program here. And you have an opportunity to drive referrals to your provider partner and receive the referrals from them for the respite care piece. Okay. So what you know, when I talked about this is kind of what we did. I always, whenever we're rolling out a program with 52 weeks marketing, I always do the model in my own company. I nail it and scale it. That's kind of my motto. Okay. And so I went from this model of referral black hole to a revenue engine. All right. And so here's what happened. So when I look at what we were doing, we submitted 40 to 50 guide referrals in 2024 when we first started doing this. And there was no tracking, no visibility with these partners because this happened all so fast and they just don't have the infrastructure. They don't have the technology or tracking. And so everything kind of stalled out. My team got a little bit frustrated. And that maybe there are some folks that ran into the same thing. Okay. So here's what we did. We partnered directly. So in my case, being a senior helpers franchisee, the franchisor developed this partnership and rolled it out to all the franchisees, which was great on their part. They just didn't have this infrastructure. Okay. So I found a partner on my own in my area that was a national provider and worked really closely. I told him the situation and what I was running into, and he's like, oh no, we can do better than that. So for the last 9 months, we've been working to streamline the process. He has a whole amazing team. He's got a technology team, and they put together an incredible platform that gives me now transparency. When we put in a referral, we can track them. So we went from, black hole to, and maybe 3 months before we heard anything, to we are literally putting in a referral and starting care within 2 weeks.
Wow.
Yes. So
that's impressive.
It is. So,
Huge.
So the results. So since August of 2025, and we've been fine tuning it, and now we're ready to scale it. But with the program, we just from August have generated $500,000, and that includes the conversions. Okay. So now we've got this scalable model that we're making available. All right. So we've brought this vetted provider. You've got referral visibility platform, complete marketing and training program. So we've, in our 52 weeks way of doing things, we've systematized it. And we're making it available to folks. So I'll walk you through that in just a minute, because there aren't going to be like 10 providers in your community. There's going to be a few. And the faster you get out there and position yourself as the guide ready person for your healthcare partners, you're going to own this. And that's what we're seeing. We literally own the greater Nashville area for all of this. And all of them.
That's amazing.
Yeah.
That's amazing. And thank you for doing all this legwork, because I feel like that is a big part of why agencies are not jumping on this right now. They're scared. They have no idea what to do. So you just did all this legwork for them, and you're being so kind to share it. Obviously you have a heart for care, and that shows just by the fact that you are sharing this information with them.
Yeah.
So thank you for that.
And Dylan and I in 52 weeks and all of our coaches, we hear, especially for newer owners who don't have a lot of payer sources. Maybe they're not Medicare certified, or they don't have the VA credentials, and it's hard to compete, where this is a payer source that everyone has access to.
Absolutely. That's amazing. So based on this, how are other agencies going to implement this where they live?
It's very doable. So what we've done is, along with our partner, our credentialed guide partner, we've created a program called the Certified Guide Ready Respite Provider Program. All right. So it sort of says it all, right? That you're ready to take these referrals and start providing the respite care, and also being in the community and educating the community, because that's really important. So what we've done is created a turnkey model where we're going to train folks. I've got a training platform that we're using and training them on how to do this. We're setting clear expectations. We want as many people from your organization to be, your team members to go through the training. The more educated your whole firm is, the better it's going to be. I mean, and I have a big shop here, and we've got 15 people whose hands touch GUIDE program. So everybody's had to go through the program. We're connecting you to this amazing certified GUIDE ready respite provider. We have easy onboarding to this powerful technology platform where you can input your referrals really easily, like literally 4 pieces of information. You'll know right away whether they qualify for the program, and then you enroll them. And you'll track them through a dashboard. So there's no more, I don't know what's going on. You literally know every step of the way, and I'll show you the timeline here in just a minute. We've created a marketing starter kit. So we're going to train you on how to get out there and educate your referral sources, educate your family caregivers. Everybody knows somebody that's caring for somebody with dementia. You've got a good news story. We've even put together materials that you'll be able to get out there and provide. We've got we've got all kinds of things that everybody you're going to be able to help them. And then we've created an ongoing marketing support and coaching platform. So
I expect nothing less from Debbie Miller.
Exactly. So this fast referral processing and authorizations, I can't emphasize how important this is. And we've learned the hard way, right? We don't want this to be a disappointing experience. We want it to be a really positive experience for the families that you just got them all excited. So this was what it used to look like. Okay. So we would make a referral, and then this was kind of the timeline. We're hearing this all over the country. It's like, oh my gosh, I might not even hear for 12 weeks, and then only to find out that they don't qualify. And how disappointing is that? Where what we've created here is, I don't know why I keep picking that, so that I can see. Okay, so where we now with the certified GUIDE ready model, you put in the referral, you actually verify the patient first that they're going to qualify, and then enroll them in the program. And all along the way, you're getting notifications. Not only do you have transparency into where they are in the process, but there's such a collaboration with our provider that they notify us if there are any issues, or if we've bottlenecked at any point, so that we can intervene, because we've been the initiator of that relationship, and so we can intervene. So it might be that there's 2 major appointments. There's a telephone interview that they do, and then there's a Zoom. That's the clinical piece, right? That they've got to lay eyes on. Well, sometimes families aren't tech savvy, so they're maybe having a hard time getting that scheduled. Well, now the home care agency can get back involved, and we might send one of our care managers over to facilitate that Zoom meeting so that they can get going through the process and not have any delays through that process. So we're starting care way back here. We're at 2 weeks is what we're seeing if we're, intervening where they've got some challenges. And so we're able to provide the care so quickly. And it's, when you think about somebody that's leaving a rehab and you talk to the discharge planner about this program and say, look, get me involved early, I'll get them enrolled. And by the time they discharge, we'll be ready to provide the respite care. $2,500, that's almost 80 hours, depending on what your billing is. That's almost 80 hours. Those are really, that can make a huge difference in terms of rehospitalizations, right?
Yes, absolutely.
So here's what it means to be GUIDE certified. This is the program. So what are, those are the things that you're going to be getting. Here's what we're requiring: that you're able to deliver quality non-medical care, that you complete all the training modules and your team completes them, that you're able to support these exhausted and stressed out caregivers, that you commit to educating the community about GUIDE, so all your referral sources, that you follow the referral workflows that we lay out in the model, and that you generate at least 5 referrals a month. So this is what, for our provider to really commit to all of the things that we've developed. All right, so this is what the referral workflow looks like. So you get out there, you're educating, you're mobilizing your referral sources to identify a struggling caregiver, and then send them over to you. Then you'll educate them about the GUIDE program, what it is, capture some basic information. Now, the one piece of information that we're going to capture that we don't normally capture, this is kind of a change for home care agencies, is their patient Medicare number, because that's important when we put them into the system and qualify them. All right, so that's going to be an important, and there's date of birth. But they're 4 key pieces of information, really, really simple. Then we'll validate that they're eligible, and then we'll work through that whole enrollment process. And then you can go ahead and set up a referral or a client shell in WellSky or Access Care or in Rosemark, right? And we will be able to go ahead and, when that comes in, be able to go ahead and provide that respite care. So you're going to monitor that patient progress through the portal and respond to any alerts. So the collaboration is so unique. You'll get notified if there are any issues so that we can help that patient and that family so that they continue to move along the workflow. And that you'll get the authorization to provide the respite care. You go ahead, you bill your partner, and they send you the check. And it's that easy. There's no waiting.
I wonder if that's if that Medicare part is why people are hesitant, because they're confused about it and they think they have to be able to bill Medicare.
Exactly. And that's what I'm here to help you guys understand. This, you don't want that problem. All we're going to do is we're going to pay our partner the way you set them up as a payer, and just like a client, and you're going to bill them and you get paid. It's a very, very streamlined process. And with the new platform, they're making enhancements all the time. All of the billing is actually going to be done through the platform here in a couple of weeks. So let's talk about the marketing program that we've wrapped this whole thing around. Okay. Of course, when we talk about that piece on the right, the community outreach path, what we've done is put together some training and some support materials to help you be successful with that piece. All right, so everything from messaging, your positioning, who you're going to call on, what you're going to say to each of these key targets. We've included some materials, the first one being this letter to your clients. That's your low-hanging fruit. Let them know to call your office so that you can enroll them in the program and, again, have more control over that referral. We're going to tell you who to target, all of these key influence centers in your area, and pretty much everybody you know, you'll be telling about this GUIDE program, this free program that gets them all the support. We've created a 60-day roadmap so that you can get off to the races and by the 60 days, you should be at least 15, if not 25 referrals. And we've got a full map every week. If you follow the map, you cannot fail. And we've given you everything that you need as far as the messaging. We've got materials there that you can customize. So you'll be able to print them in PDF and put your logo. Thank you. Sorry, I don't know if you can see the calls coming in. I should have put myself on do not disturb. Okay, sorry. Yeah, so you'll be able to customize this, put your own phone number, put your logo in, you're ready to rock and roll. All right. We actually have a printer who is now working with us to provide support to folks that are in the program, where they can have these custom made. They've made it really, really easy and very, very affordable. So we have nothing to do with that. I didn't want to have to worry about that. We've got too much going on with 52 weeks and all the things that we're doing. So, but we did, this is incredible. We have a full slide deck to help you get out in your community and educate your referral partners, educate family caregivers. So we've got this amazing deck. You get to tell them all about it. And we even have speaker notes. So you don't have to recreate the wheel. I've done it all for you. And by the way, we've done a pilot. We have 20 folks that are already certified GUIDE ready and out using the materials and doing all of this. He just presented this last week, and he could not wait to tell us how great it was. He's like, I've given a lot of presentations in my professional life, but I've never had people react like this. I could literally see the amazement on their faces. What I didn't expect was the enthusiasm to refer families to me who couldn't afford care. Again, these are people that he never would have had access to.
Yep.
So it's opening up this whole opportunity for us to interact with these patients who need help. He said, this is a game changer for us and for our community. And this is just, thank you, thank you, thank you. He was so excited from the very beginning to be part of our pilot. We're now rolling out another 30 in the pilot this week. So, so it's just getting going. So
that's amazing. Well, you read my mind. You read my mind. That's what I was going to ask. So you've done all this legwork, like I said. I know Debbie, and if you don't know Debbie, welcome. Let me introduce this person who puts so much effort into absolutely everything she does. So you've created this amazing program that you are sharing with others. And I know that the majority, like, you've done this out of the goodness of your heart, but somebody's going to ask me, what is in it for you? And you do wear many hats. So you've talked about 52 weeks marketing. So I'm sure there's a little bit going on in the background. So just be open and honest. What is in this for you?
So, as you know, I don't know if I've mentioned this along the way, but this is a free program for anybody that wants to participate. Yeah. So when we think about when we think about our partner, let's talk about our partner first. What's in it for them? Okay. So or what do you get with bringing them to the table? You get the virtual medical clinic with a very robust infrastructure that we've been helping to fine tune as we've worked through the kinks in my own organization. They have built a best-in-class software platform. There is nothing like this out there. And they have a dedicated success manager for our certified guide-ready respite provider members. Okay. So from 52 weeks, what are you getting? You're getting the training program. You're getting the materials. You're getting our expertise. All right. So what's in it for us? All right. From a provider perspective, what they need are partners, because they're getting all these folks that want respite and they can't help them. So they need agencies like us to be able to fulfill that key component of the guide program. All right. So they're looking for partners, and they literally need thousands of partners right now. All right. What's in it for 52 weeks? It's exposure to home care agencies who may be open to getting some assistance with the 52 weeks marketing program. It gives us exposure to folks that maybe wouldn't have heard of 52 weeks marketing. And with our newest company, which is Helper Heroes. And we're providing virtual assistants to fill roles like schedulers, recruiters, on-call folks, and things like that. So we get exposure to the people that we may not have met before, and hopefully become clients of ours. So it's as simple as that.
It's incredible, though, man. I don't even have the words. It's incredible, Debbie.
It's a win-win.
So it absolutely, well, I think you're doing yourself a disservice by saying that, like, it's even more of a win for the other people because you've already done so much research. So thank you for your heart for care. I mean, I know that you didn't just do this like for yourself. You did this for the community, and that is huge. So thank you from the community. I will just say it from them. So for those who are going to jump on this, like, what is their next step to become a partner and do this amazing thing that you've put together?
So let's talk about it. We've tried to make it as simple as possible, and I've created a platform that is going to kind of take people through step by step. So you click on the link below or the QR code, or just take that URL and plug it in, and you'll be able to go to that initial landing page where you'll register, and then you'll gain access to the introductory webinar. And the introductory webinar is important because it's going to introduce you to our guide, our credential guide partner. All right, so you'll get to meet him, the CEO of the company, and you'll hear a lot about what I just said in this one, but this might be something that you might want to share with your partner in your business, whatever it is. It's just the introductory to the program and definitely introduces you to the partner. And then you're going to follow the steps. So they have an agreement that you have to sign, and there's some steps along the way to make it official that you are a partner, and CMS requires some information. Then you will get an email. Once you've done all those steps, you'll get an email that has, you'll send you back to our platform. It's called Kajabi, is the platform that we use, the training platform, and you'll have access to all the training modules. You want to register everybody from your team to work through the training modules. There is a test that you must pass, get an 80% pass before you gain access to the marketing materials. And that's for us to just maintain this higher standard, and for our partner to feel confident in the folks that that they're, giving these respite referrals to. And then once you go through all the training, they will onboard you into the partner portal, where you'll be able to make the referrals and track your referrals and get your authorizations, etc. And then enroll into our ongoing marketing support. And you'll be able to literally, this is the only thing holding you back here, is the time that you dedicate to this. These sessions are about 30 minutes, and there's about 6 or 7 of them that you'll go through, and then you'll get onboarded into the portal, and you will be off to the races. So
That's amazing. Do you have like any idea how long that will take? I mean, obviously the training is on their own, so that's up to them, right? But the rest of the onboarding process, like, are you thinking this will take an agency 2 weeks, a month?
No. You could do this in a week. Easily.
Wow. Okay.
Yes, easily. For example, our pilot teams, we got them up and running within days, but it was a manageable number. We're expecting hundreds and hundreds of people to come into the program. And so the training is, get through the training and get scheduled for the partner portal onboarding as fast as, that'll be sort of the thing that could hold you up. But just follow the bouncing ball. It's as systematized as we could make it, which is what we're always trying to do with 52 weeks marketing.
Man, I'm just shocked with the free part of it. It's a no-brainer to me. It is. So thank you again for sharing this model with other agencies. It's going to help them grow. It's going to help them grow a lot if they put, just a tiny bit of time, like you said, invest in this and learn something new. And everybody right now is looking for something that differentiates them from the competition. And this is a window to be the first to educate others in your community about the GUIDE program and funnel those referrals to your agency. So Debbie said this is $1 million opportunity. I couldn't agree more. This sounds amazing. So thank you, Debbie, for this very helpful, very detailed information. You really got into the nitty-gritty, so I appreciate that. But before I let you go, I told you I wanted to hear more about your other stuff. So give us some information about how people can learn more about 52 weeks, because I love 52 weeks. I recommend it all the time. And I want to know about Helper Heroes, because that's something new since the last time I spoke with you that you started. So I need all the details.
Well, with 52 weeks marketing, our whole focus is helping agency owners and to grow their business. And we've put together a turnkey marketing system to help people do that, so that you have something fresh and new to talk about, to build relationships with those important referral partners. And in doing that, we talk to people every day, and we do a lot of coaching, a lot of sales management, things like that. And what we were finding is a lot of folks are getting pulled into the operations and not being as consistent as they need to be to focus on marketing and grow their business. So you have to be consistent. It's that engine. I always say there's 2 engines. You've got to be constantly recruiting, constantly marketing. But if you don't have the infrastructure, you're going to have a hard time focusing on marketing. So what we did, and certainly in my business, first of all, we over the years have built quite a large infrastructure, but it's been expensive. Every time we hire somebody, we're in the $55,000 to $60,000 salary range. And so when COVID happened, I started to offboard some of our roles, scheduling, recruiting, And so anyway, long story short, created a model and actually worked with a partner. Dylan and I own this business with a partner who is in the Philippines. Her name is Saudi. And the business is called Helper Heroes. And so I have 8 full-time virtual assistants doing different roles within my organization. I've saved $300,000 in 2025. It's been incredible. The morale in my organization, because we've been able to offload a lot of the more menial tasks, or not menial tasks, but the tasks that allow them to focus on, what's going to really drive the business. Now, we've increased our scheduling department now with virtual assistants. So we've got 4 dedicated people in scheduling. I've got 2 full-time after hours and weekend on-call people, and I have 2 full-time recruiters and a billing finance person. So those are incredible roles that are, expensive to the staff for, but now we have these folks that are doing it virtually from the Philippines. So it's been amazing. We have already, we have over 100 virtual assistants placed in agencies across the country. And we've only been doing this since, I don't know, March of last year. So it's growing, and it's been incredible. Again, to scale it or nail it and scale it. And so it's been working out really, really well. And what I love about it is it helps people to stay focused on growth and get the support that they need, that without breaking the bank, right? Especially for newer owners. It's like every time you need another person, it's like, but I'm just starting to make money, and now I've got to go and hire this person or that person. And this is at a much reduced rate, but you're getting quality people. We're talking people with, university education, English amazing. I mean, the Philippines has been doing this for a long time. Home Care's just discovered it, and we were blessed to find an incredible partner who is, just doing an amazing job for us. So
that is awesome. I love that you guys have been doing that, because, like you said, as you're trying to grow and you're a new agency, man, filling some of those roles, it's hard. And a lot of times you're on the bench waiting for somebody who's called out to go fill in that caregiving shift. So you're right, it's taking your time away from a lot of these very important tasks that need to be done. Mm-hmm. So having someone there to help is really important. And right now, I mean, you and I are having this call from Chattanooga and Nashville.
Exactly.
So we know that things are done virtually all the time.
Yes.
So this is just another great example of how to use that ability.
Exactly. Yep. Well, thank you for the opportunity to talk a little bit about it. Here we go. That's the exposure piece, right?
That is awesome. Thank you so much, Debbie. I really appreciate you. I always enjoy our chats, but I always enjoy not just talking to you as a person, but finding out what you're doing to contribute to the industry, because this is amazing. 52 weeks was already great. Like I said, I recommend that to everybody that I come in contact with, because I'm like, you don't need to be doing your own marketing. You need to be caring for people and running your agency and focusing. So take that thing off your plate and give it over to somebody else to do it. Yeah. And now you've got Helper Heroes. I am so excited to learn about that. I had no idea that you guys were doing that. That is awesome.
Never a dull moment. Never a dull moment here in Nashville.
No kidding. When I said she wears many hats, y'all, you don't even know. There's more than this in the background. I'm not even going to bring up. So thank you again, Debbie. All this information is going to be on our website. So these QR codes people can scan whenever they need to. If these URLs ever change, please check the notes for the website, and I will update any links if they change in the content of the website copy. So that's all we've got for now. Thank you again, Debbie. And I hope that everybody has a wonderful day, and that we hear all about you starting to be participants in this guide program very soon.
Yes, get guide ready. Take advantage.
That's awesome. Take care, everybody.
Thanks,
Bye-bye.
Nicky. Bye.
Thank you.